during the lunch break, I was kind of reflecting on the upcoming session. Great to have the opportunity to introduce our next speaker. So pleased to be joined by someone who's held numerous significant leadership roles, demonstrating ongoing commitment to driving innovation. So Deputy Minister Greg Orensek previously served as the Deputy Minister of Advanced Education Skills and also was a partner at Ernst & Young. And he has extensive experience with the Government of Ontario in roles such as Chair of the Public Service Commission, Deputy Minister of the Treasury, Board Secretariat, Deputy Minister of Finance, and just a few months ago he was appointed as Canada's Deputy Minister of Health. So in this session I'm going to ask Greg to come up and say a few words, and then I'm going to ask him some pointed questions. And then after that, I think we will have time for members of the audience to also ask some questions before we conclude the session. So with that, I'll hand over to Greg. Thank you.
Great. Thank you. Thank you very much, Michael. Thank you for that kind introduction. Let me just say it's really good to be here. It's very nice to be able to join you, and it's nice to see some friends in the room as well. I also want to begin by acknowledging that I'm joining you today from the traditional unceded territory of the Anishinaabe Algonquin people. It's great to be here, like I said. Nice to be surrounded by innovators and leaders who are directly shaping the future of digital health. I'm really grateful to learn from you as well about digital health and the critical work that everyone is doing in this room. This year's conference theme, Pathways to Progress, rings especially true. Since I've joined Health Canada in August, I've just really been impressed by the incredible progress in the digital health space over the last couple of years and the strength of this sector. It's really encouraging how much can be accomplished when we all work together toward a shared priority. And today I just want to take a moment to recognize the tremendous work that everyone has been doing to advance connected care. Our collaborative efforts today are more critical than ever before as our healthcare system faces a lot of pressure. Each day, the lack of interoperability makes it challenging for healthcare providers to deliver timely and high-quality care. Over a third of physicians today say that they spend 2 hours or more each workday beyond what they feel should be spent looking for the patient information they need to provide care. We know that seamless, interoperable digital systems that allow the flow of health data can significantly enhance care and improve patient safety. Health data is one of the most powerful tools we have for driving meaningful improvements within our system of healthcare. So there's an opportunity, a real opportunity for us to work together to leverage this potential. Progress on digitizing healthcare is evident across the health sector, but there is still work to be done on improving interoperability and connectivity between digital tools and systems to support the effective flow of information. There is no doubt an urgent need for consistent national interoperability standards that facilitate the secure flow of information across the health system. Aligning these standards internationally would also enhance the competitiveness of our Canadian digital health companies on the global stage by facilitating innovation and reducing the need to comply with different requirements. We must also prioritize the human side of data sharing, making sure the people, processes, and policies in place to govern the use of health data work for the digital age. Now, advancing a vision for connected care is a top priority of Health Canada, and I know that there have been significant strides towards realizing this vision. In February of last year, the government announced the Working Together to Improve Healthcare for Canadians plan, which allocates significant funding over the next decade to enhance our healthcare system. Central to this plan is the modernization of health systems through standardized health data and digital tools. The Joint Federal Provincial Territorial Action Plan on Health Data and Digital Health as well as the Pan-Canadian Health Data Charter, are guiding Pan-Canadian efforts and provide a clear path forward for ongoing collaboration. Federal, provincial, and territorial governments are also working together to implement the shared Pan-Canadian Interoperability Roadmap, developed by Infoway in conjunction with key stakeholders and partners, including the Canadian Institute for Health Information and Statistics Canada. This roadmap outlines collective areas for action, including enabling patients access to their records, data sharing among providers, and care coordination. In concert with the roadmap, clear rules of the road are being defined to guide how health data flow should be managed safely, securely, and with privacy as the top of mind. We need to learn as a system how to do health data management. Provincial and territorial deputy ministers of health tasked the Canadian Institute for Health Information to lead on developing a health data stewardship framework that aims to do just that. It will remove technical barriers while empowering people to share data effectively and responsibly. Taken together, progress in these areas will mean healthcare providers can deliver effective care, policymakers can make informed decisions, researchers can access accurate data, and patient safety can be significantly improved. As you're likely aware, Bill C-72, or the Connected Care for Canadians Act, was introduced in Parliament in June of this year. The bill reinforces the objectives of connected care by requiring the adoption of common technical and data content standards and prohibiting data blocking by health IT vendors. It would enable the secure access, use, and exchange of health information across health IT systems in Canada. Should the bill receive royal assent and be brought into force, it is intended to act as a backstop only in the provinces and territories without similar legislation also in place. Now, looking forward, what would success in these areas mean for Canadians? It would mean that healthcare providers would have timely access to health information, reducing their administrative burden and freeing up more of their time to be spent with patients. It would also give providers the complete patient picture they need to make better decisions that prioritize patient safety. It would also mean that patients would have access to their health information, which could help them better manage and make informed decisions about their own health. Beyond the benefits to patients and providers, our strained healthcare system would also be positively impacted. Infoway estimates that improving interoperability could yield cost savings of up to $1.75 billion each and every year. So as we navigate the challenges ahead, we know the path to a stronger, more resilient healthcare system goes through our ability to break down barriers to data exchange. So I commend everyone, provinces, territories, healthcare providers, health IT vendors, working tirelessly to connect health systems, recognizing your critical role in enabling smooth and secure data exchange across the healthcare ecosystem. We all have a part to play in building a connected care system that empowers clinicians, improves patient outcomes, and ensures our healthcare system can meet the evolving needs of Canadians. Thank you for your leadership and your dedication to this work.
Great. Thank you very much, Greg, for those words. And as I mentioned, I had a few questions for you, and then hopefully we can open it up to the audience when we have time. So first of all, quite a common question, I think, for someone in a new role. You've recently stepped into this role as Deputy Minister. In your first 100 days, what would you see as your most urgent priorities?
Great. I get this question a lot, so I can't say that I'm not practiced, but it's actually almost 100 days since I've been appointed as Deputy Minister of Health. It's a really great privilege to occupy this space and to have this vantage point. It's been really nice to get to know colleagues from across the department, across the federal public service. as well as across a broad group of stakeholders. And I think I'm still appreciating the breadth of work that the health portfolio actually does. In terms of what I'm spending most of my time on is focusing on implementing the government's priorities. There is a lot on the go. I think you've heard from the minister before lunch in terms of all the things that are on his mind. And I think it is a busy, ambitious agenda, very much linked to improving healthcare for Canadians in a number of different ways. I know that we will continue to be hard at that, and it's also work that really engages our partners, so that's been a really important focus for me as well, to be able to connect broadly and see things through, as well as anticipate emerging issues that could be around the corner.
Great, thank you. And you've made a move from provincial to federal roles. I'd be interested in your kind of insights on the key differences between working for a provincial government and now working for the federal government.
Great. So let me talk about the similarities first. I think in many ways, the work that we do and the values that we share in terms of providing nonpartisan, evidence-based advice to ministers is fundamental to how we do our work and how we maintain the trust that's required to be able to effectively serve the government. Now, there are obviously key differences in terms of the size of federal and provincial governments, even from where I came from, and that was a pretty large province with a very large budget that I had the privilege of helping to manage. For me, coming from the province of Ontario to work for the federal government in this portfolio, there's a huge difference in terms of the role that each of us plays in an area such as health. However, in all cases, some of the truisms hold true. Really important to maintain good relationships, really important to work collaboratively, even if it's in a much more complex space as it exists at this level. And also paying a lot of attention to sort of understanding what's happening on the ground. It's easy to be maybe a little bit more removed from that in the federal scene, but especially as it relates to healthcare. Really important to sort of understand how the front lines are doing and what's happening where the stressors are, because behind each stressor is a potential opportunity for a solution and an innovation in this space as well.
Great. In your opening remarks, you talked a bit about digital health, and I just wanted to drill down perhaps a little bit more on that. And so if we look at health data interoperability, it's cited as being critical to advancing patient-centered care. So what do you believe are the kind of foundational steps for Canada in terms of improving these data sharing capabilities across all the different jurisdictions? There is a lot to do, and I think there's a lot that is actually being done. So I am optimistic in terms of the opportunity before us. But fragmentation is a problem. It is, more than suboptimal when health data gets logged in different systems that cannot connect to one another or cannot talk to each other. So the technical interoperability challenge is really important to overcome, and it's fundamental for Canadians to be able to access their own health data, and for that health data to more effectively and securely flow without barriers to everyone who's involved in the care of patients. And it's also important to us as decision makers
to help improve how healthcare is delivered and funded in a more comparable and comprehensive fashion. Like I said, there are several things in flight, many of which are really exciting. Bill C-72 is one of them. It's one part of the solution, but the solution is not only about technology itself, it also comes down to people and how people interact and how people use the tools that are available to them. So really important in that context for me to make sure that we work together on the right kind of governance and change management as it's related to health data management, and that's why our stewardship frameworks on health data are so important. So let me stop there.
Great, yeah, and certainly there's a lot of coordination required, very definitely. And you mentioned kind of innovation, and in terms of, the audience here, we have some vendor or the industry partners who are providing a lot of technology. I'd be interested to know what role innovation kind of plays in your vision for Canada's healthcare system, and how can we encourage more investment in innovative health technologies?
So innovation is fundamental in terms of how we move forward to develop, build, nurture our digital health infrastructure, and a really important component of the connected care vision that we're all, I think, standing behind. For example, like the kind of innovation that we're seeing as it relates to electronic health records, some of the virtual care and telemedicine platforms that exist are all hopeful and really useful in terms of how we can improve care coordination and timely access to care to help improve health outcomes. I think some of the key ingredients that I think will help continue to fuel that innovation will include the implementation of consistent pan-Canadian standards that I think will help enable more of that innovation to occur amongst our IT vendor community. And I think it also helps open up other markets and helps our innovators operate at greater economies of scale as we look at international markets, as we look at ways in which we can align our data standards with international standards so that we can continue to show leadership in this space well beyond our borders. Last but not least, I think everyone is talking about artificial intelligence and all the tools that AI can help enable in terms of better outcomes. I think that is very true in healthcare, and I think there are tons of opportunities in healthcare that we're seeing internationally, and we know that AI runs on good, high-quality data, so it's really important for us to continue to pay attention to how we make sure that those inputs from the health sector continue to support the development of AI.
Absolutely. I'm glad you mentioned AI. I think a number of our partners here today, industry partners, have got some AI applications that are really interesting and will certainly make a difference to healthcare delivery coming up. So I'm going to look around and see if we've got anyone in the audience who wants to ask a question. And I don't see anyone just yet. Everybody's being a bit shy after lunch, I think. But if we're waiting, I can ask one more question from my side, definitely. So I was interested, what your priorities are for reducing health disparities. If you look at Indigenous populations and also remote populations as well.
Yeah, so good question, Michael. I think, technology is an important component of that, and especially in a country as vast as extensive as ours. We've seen the deployment of technologies in terms of virtual care platforms and telemedicine that helps bring care closer to people and where they are. The other thing that I'm sort of really encouraged by is the ongoing work and partnership with provinces and territories. And I've sort of come from a province, so I can certainly see the value of what we can accomplish when we work together. And there isn't really, a one-size-fits-all solution necessarily, as it relates to some of our unique needs. We share a lot of things across how we deliver healthcare across this country, but there are also bespoke and unique needs, and the more that we can work together and create the opportunities and the agreements that enable us to tweak things in a way that makes sense in one part of the country without taking away from something else that's working in another part of the country. I think that's just really important and useful work, and I think that's what officials and public servants are good at and can pay very close attention to.
Yeah, it was interesting to see, often infrastructure is an issue, isn't it? And recently I noticed Ontario announced a big contract with Starlink to kind of get internet services in a number of northern communities, which I guess will make a potentially big impact in many places. Well, I think we have at least one question from the floor, so I can see someone on the right-hand side there. So please let us have your question.
Thanks. Simon from Infoway, thanks for joining us today. The health minister talked about some of the priorities that related to dental care and pharma care, which was wonderful to hear about progress in those areas. And I was curious if you had thoughts on how digital can support those priorities.
For sure. I think, when I sort of look at dental care and the way in which that program has been set up, it's rare and unusual that you get to set up a program on that size, scope and scale from pretty much scratch. So I know that, for example, one of the things that we've been advancing with providers in the dental care space, which is still a very paper-based administrative system, has been the implementation and sort of greater reliance on digital tools in respect of our administrator in that program. And I think that speaks to me about the opportunity to sometimes easier to lean into things when you're doing them at scale, and it's easier to sort of make that business case and bring others along, even if they may have in the past been resisting, and maybe it didn't make as much sense for them as it does when you're making a big change. So that's one reflection on that I think speaks to your question.
Great. So I don't think I see other questions, and we're coming close to time. And so, I would certainly like to thank you very much for coming to speak to us today early in your new mandate. We work very, very closely with your colleagues at Health Canada, and we've enjoyed a very great collaboration, and I certainly look forward to a future collaboration with yourself and your team. And I wish you every luck in your new role.
Great, thank you very much, and just want to sort of echo that in terms of the partnerships that exists at all levels, and really commend you for bringing this crowd together and the great work that you're all doing, and looking forward to meeting more and more of my new friends. So thanks for being here.
Great, thank you very much.